Anusha, thank you for that. So as you can see, parents have questions, kids have questions, no doubt, so do teachers and staff. Joining us right now is clinical nurse specialist Alice Benjamin. Let's try to answer some of these questions, Nurse Alice. What do you tell kids going back to school about COVID and masks, and how young should you start telling your kids? Do you need to tell a kindergarten student about this?
I think that it's wise for us to start having age-appropriate conversations with our children because they want to know what's going on. And the only way that they're going to adhere to the guidelines and recommendations and the activities that we're asking them to do is if they understand it. So, who's too young to talk to? I really can't answer that because I think if your child can follow instructions, that's the best time to talk about them. But let's talk to our kids about wearing masks, physical distancing. What does the signs and symptoms of COVID look like? And, why it's important to wear a mask. I mean, these are conversations that we should be having every day, not just a one and done. And it starts at home, Colleen. I mean, we really should be modeling the behavior that we want our children to adopt. And that starts with wearing masks and getting vaccinated, physical distancing, and including them in the conversation.
So the Delta variant really is changing the landscape out there. What does it mean for younger kids? Are we seeing more and more kids? Are they more susceptible to this COVID?
Well, we know that the Delta variant is the most widely variant out there, responsible for up to 90% of infections. Now, when it comes to children, they are responsible for anywhere from 12 to 19% of new infections. Now, the difference with children is many of them are asymptomatic or they have very mild symptoms. And I think it's important for parents to know that even if your child does contract COVID, only 2% result in hospitalizations, and even far less than that results in death. So I know it's something that we're worried about, especially since we have 1.3 million children in Los Angeles County who are not yet eligible. But that's why we need to take all the precautions that we can to protect our young children, especially as we want them to go back to school, because that's the best place for them to learn.
Let's talk a little bit about specifics at schools. Some schools are making masks optional. During recess outside, you recommend that kids take their masks off or keep them on when they're outside like that.
Colin, I don't think there's a one-size-fits-all type of answer because I think we really need to look at the population. So, for example, I said 1.3 million children in LA County aren't yet eligible. About 60% of those are our pre-K through fifth graders. So they're not vaccinated. So I think it's extremely important that those children are always wearing their mask at every opportunity. And when we get to your, high schoolers, middle schoolers, it's going to be important for them to be vaccinated to add another layer of protection. Because when it comes to keeping our kids safe, it's not a vaccine or a mask. It's going to be a multi-layer approach. Vaccines, masks, physical distancing, washing your hands, and staying home if you have any type of symptoms, even if it's just your nose is stuffy. It could be COVID. We don't know yet. So it's going to be important to stay home if you feel you're sick or you've been exposed.
Well, you raise an interesting point here. We're talking about COVID, but, we're going into fall, so the usual viruses are also spreading as kids go back to school. So how do you tell the difference between a common cold, maybe allergies, and COVID? And should it matter? I mean, should you stay home if you get any kind of sniffles?
Well, I think the most definite way that we're going to know the difference is if you get tested. That's the only number one way to positively know. We know that there are over 200 viruses that can cause common colds. We know people have allergies and there are shared symptoms, cough, sore throat, runny nose, sneezing, headache, all those things. The things that are not common for COVID not common for a cold that would indicate more of COVID would be nausea, vomiting, diarrhea, any type of fever or shortness of breath. Those symptoms are more indicate to us that it's more likely COVID, especially in an unvaccinated person. But again, many viruses out there, the only number one way you're going to know is if you get tested. But when in doubt, stay home, get tested, and take care of yourself.
Nurse Alice, as always, thank you for your expertise. We certainly appreciate it.
Thank you.
Take care.